Hello, I am Lynn Wilkes, Education Coordinator. I will discuss how to prevent needle stick injuries, or NSIs, by using safety needles properly. A needle stick is the penetration of the skin by a needle or other sharp object that was in contact with another person's blood, tissue, or other bodily fluid before the injury. Needle stick injuries potentially increase exposure to bloodborne pathogens such as hepatitis B, hepatitis C, and HIV. At mass vaccination events, there is an increased risk of needle stick injuries because of unfamiliar equipment and other distractions. There are 4 main types of safety needles that have safety devices as part of the needle and/or syringe itself. These safety devices are activated with the same hand used to administer the vaccine. When safety syringes are used correctly and immediately disposed of in a sharps container after use, it should almost eliminate the possibility of needle sticks. Prior to administering the vaccine, perform aseptic hand washing technique per protocol. Let's review the BD Eclipse safety needle. Depending on the brand, it may also have the word edge on the package, as an edge of a hard surface activates the safety device. After administering the medication per protocol and removing the needle from the patient's arm, using the same hand you used to administer the vaccine, immediately and gently press the safety cover on a hard surface such as the edge of a table. You may hear an audible click as the needle fits into the safety cover. Do not use your other hand to assist in the process. Visually confirm the needle is fully engaged into the needle safety cover. Immediately dispose the entire device into a sharps container. The second safety needle to review is the Vantage Point syringe system. It uses a spring design that automatically retracts the needle directly from the patient's arm into the barrel of the syringe when the plunger handle is fully depressed. After administering the medication per protocol and fully depressing the plunger with thumb, squeezing through the resistance point to deliver full medication dosage, the needle will automatically retract directly from the patient's arm into the syringe barrel. Once the needle is fully retracted, you can remove the syringe from the patient's arm. Once you take the syringe away from the patient's arm, you should see the retracted needle in the barrel. Immediately dispose the entire device into a sharps container. The third safety needle is the Safety Glide syringe system. It uses a levered arm system activated with one finger to completely cover the needle tip. After administering the medication per protocol and removing the needle from the patient's arm, using the same hand that you used to administer the vaccine, immediately activate the safety mechanism by pushing the lever arm completely forward with your finger until the needle tip is completely covered. Activate the safety mechanisms away from self and others and do not assist the process by involving the other hand. Visually confirm the needle is fully engaged into the needle safety cover and immediately dispose the entire device into a sharps container. There is a fourth safety needle you may encounter. It is the Longevity Retractable needle, which uses a feature to draw the needle up into the syringe barrel. After administering the medication per protocol and removing the needle from the patient's arm, pull the plunger back to draw the needle into the syringe. Once you have pulled the plunger back to the end of the syringe barrel, detach the plunger from the barrel, leaving the needle inside the syringe barrel. Immediately dispose the entire device into a sharps container. If needle stick injuries occur, immediately contact a supervisor and note the details of the incident, including date, time, and patient's name. If a needle stick injury occurs while mixing the vaccine, it is considered a sterile needle stick as the device has not been injected into a patient. Even though the vaccinator is not at risk for exposure, it does contaminate the dose, which requires waste and may result in contamination of the vial. Additional resources and training recommended include CDC, what every worker should know, how to protect yourself from needle stick injuries. Thank you.